Porphyria is a condition in which a rare hereditary disorder in which abnormal metabolism of blood pigment hemoglobin porphyrins are excreted in the urine becomes dark, including symptoms like mental disturbance, extreme sensitivity to skin to the light. Now we will be looking at in depth about the porphyria. So porphyria is a condition in which precursor of heme development accumulates in the body and results into many neuropsychological psychiatric symptoms. Like heme is made up of a multiple enzymatic steps. In porphyria, one enzyme is deficient that build up in the body and result into the damage of the nerve, skin, and sometimes both. So whenever there is nerve and skin is damaged, so the symptoms appear, and those symptoms give rise to the different conditions and findings. Okay, so in simple terms, we can say porphyria is enzyme defect in heme synthesis, and then porphyrins accumulate in the body, results in neurovisual or skin symptoms, and we will be looking at what kind of the symptoms are these. So there are types of the porphyria like acute, intermittent porphyria, acute intermittent, and porphyria cutanea tarda. So now, as I mentioned there, that heme metabolism steps are missing, and then those missing metabolic steps results into accumulation of porphyrins. What happens, succinyl CoA and glycine are broken down into AL with the help of enzyme ALS synthase, and they give rise to the aminolevulinic acid, and then they give rise to the porphobilinogen, and then with the help of certain enzymes they give rise to the hydroxymethylbilane, then urobilinogen 3, then corpobilinogen 3, and then in the end there comes our heme with iron and then hemoglobin, and then that heme and globin binds and form hemoglobin and into the red blood cell, liver for synthesis of different oxygen transport mechanism and things like that. So whenever there is a nasty enzyme deficiency, porphyrins build up in the body and give rise to the many nasty issues. And then there are two types of the porphyria like acute intermittent and porphyria cutanea tarda. Acute intermittent porphyria is porphobilinogen deaminase deficiency. In porphyria cutanea tarda, there is urobilinogen decarboxylase deficiency. So what happens in acute intermittent porphyria, there is porphobilinogen or ALA deficiency results into the five symptoms. These symptoms are memorized through 5P. P for painful abdominal pain, port wine color. P, polyneuropathy, psychological disorder, precipitated factors are increased ALA synthase. These are the drugs cytochrome P50 inducers. Alcohol starvation. Treatment is hemin, and glucose is the treatment of the choice for acute intermittent porphyria. Another nasty thing is porphyria cutanea tarda. Now, as the word indicates, porphyria cutanea means cutin or skin will be involved somehow in some things like Europorpho Uroporphinogen decarboxylase deficiency results into the a tea-colored urine, cola-colored urine, tea-colored urine will be there, and then there will be blistering on the skin, photosynthesis, photosensitivity, hyperpigmentation, and most common porphyria occurs in alcohol consumption. People causes familial or hepatitis C. Treatment is phlebotomy, sun avoidance, anti-malarial treatment like hydroxychloroquine should be given. It is the treatment of the choice for porphyria cutanea tarda. So in this way we can treat the porphyria, and let me show you some images of porphyria cutanea tarda, like how porphyria cutanea tarda patient present, like photosensitivity in the skin. So this is the thing that you have to keep in the mind about porphyria.